welcome to Pediatric Grand Rounds. This is a really, really special day. So thanks so much, everyone, for being here. Before we get started, just some reminders from us. Please stay muted. I think we're going to have you muted during this presentation. So really important, if you have questions or comments for our speaker, please add them into the chat box at the bottom of your screen, and we will share them with the speakers during the Q&A at the end. And a couple of disclosures that I've been told to read, so I will read them. The first is the usual. Our planners for Grand Rounds have no relevant financial relationships to disclose. And then also, Seattle Children's Hospital is an organization recognized as a public charity under Section 501c3 of the Internal Revenue Code. As such, Seattle Children's Hospital cannot and does not endorse or oppose any candidate for elected public office. Any views being expressed today by our speakers are by our speakers and not Seattle Children's Hospital. Thank you for listening to that. I will turn things over to Dr. Trahan, who will do introductions for our speakers, plural. Thank you.
Thanks, Suzanne. Today we have a really special Grand Rounds. I think will be especially of interest to our residents and fellows and more junior colleagues, mostly because I don't think there's going to be any molecular biology today. So that's always fun. We've got a couple great speakers. I think they're going to inspire us. Young and old. We're going to hear about the interplay between public policy and healthcare. As we've seen from the events from this past week, we can't really forget that the two are linked together. We don't practice medicine in a vacuum, and advocacy is an essential part of our jobs. And we need to use evidence from clinical studies and from epidemiologic studies to really advocate for policies and laws and programs and funding that are going to be the best for the children we take care of. So the two esteemed pediatricians that we have today have used evidence-based clinical medicine to practice writ large and expand beyond the bedside. So I'm really excited to hear from them. Our first speaker is Dr. Kim Schreier, who has represented Washington's 8th Congressional District since 2019. She is a community pediatrician and took care of thousands of children full-time for 17 years before embarking on this expansion of her career. She was initially inspired to pursue a career in healthcare after being diagnosed with type 1 diabetes at the age of 16. So she really knows healthcare from both sides of the examining table. She's the first and only pediatrician to have served in Congress. And so we're really lucky to have her today. As you can imagine, she's got a very busy schedule. So we're going to let her speak at the beginning so that she can get onto her other meetings for the day. Thank you so much for joining us at Grand Rounds, Dr. Schreier.
Well, thank you, Dr. Trahan. It's wonderful to be here and wonderful to see my friend Annie Andrews. I'm Kim Schreier. Thank you for that introduction. Most of you probably know who I am, a pediatrician from Sammamish. And in 2019, as you just said, I was sworn in as the first pediatrician ever elected to Congress. About time, huh? And at the time, I was also the only woman doctor in Congress. And I'll tell you that along the way, I had this vague sense that it would be important to have a pediatrician and a woman doctor in Congress, that House of Representatives should be representative. But I'll tell you that when it really hit me that I needed to be there was once I was already sworn in, and we had measles outbreaks across the country that frankly were fueled by online misinformation about vaccines. This is sounding kind of familiar to all of us. And my very first meeting as a member of Congress was with the American Academy of Pediatrics. And it was so great. It was like sitting in a room of friends and family. And together we brainstormed about what my first bill would be. And we decided together that it should be a bill to take on the issue of online vaccine misinformation. Now, that bill passed the House, the Senate, and was signed into law. And it became the key resource, really, and very well funded, that would help educate the public about the coronavirus vaccines. Who knew at the time? So since then, it has been and it has become abundantly clear that we do need pediatricians, we do need women doctors in Congress and in policy leadership and advocacy across the board. And you just have to stop and think about it. We are experts in so many of the issues that are facing families today: childcare, child safety, gun violence prevention, nutrition, WIC, healthcare access, vaccinations, drug pricing, education, and more. And frankly, we need more of us. And so I am just so delighted that you get the chance to meet my friend and fellow pediatrician, Dr. Annie Andrews, who is such a strong advocate for children's health. And I will tell you that I look forward to spending many years working together on behalf of children and families nationwide. And the floor is yours, Annie.
Thank you, Dr. Schreier. Thank you for being here. I appreciate you spending some of your time with us this morning. And I'm going to pass it back over to Dr. Treeham.
Yeah, thank you so much, Dr. Schreier. As mentioned, our next speaker is Dr. Annie Andrews, who I had the privilege of knowing very briefly in residency. She was a couple years behind me, so I didn't get to know her as well as I had wanted to. And I ran into her name again like 10 or 12 years ago when at my old institution where I was working on updating our asthma pathway. I was trying to convince the pulmonologist that we should change our steroids that we used. And her name kept coming up in all the literature on this. So she has become a real superstar in many domains. She did her medical school and residency at the University of Cincinnati and Cincinnati Children's Hospital, after which she went to the Medical University of South Carolina for a general academic pediatric fellowship and a Master's of Science in Clinical Research, where she stayed on as faculty. So like I said, from a research standpoint, she's been a superstar. She's got NIH funding and Doris Duke funding and has had more than 50 papers across a wide swath of pediatrics, especially a focus, I would say, on cost-effectiveness research and improvement of asthma management among both hospitalized patients and outpatients. In the educational domain, she's been a leader in their pediatric hospital medicine fellowship and their general academic pediatrics fellowships. She also developed and led the advocacy track for their residency program. But the reason she's here today, probably mostly, and her biggest contribution, I would say, is for her amazing and tireless work in the advocacy domain, especially in gun violence, working strongly with Moms Demand Action and other groups. And in fact, she had, I think, a very seminal paper in pediatrics a couple months ago showing that gun violence has now surpassed motor vehicles as the leading cause of death in children in America. So without further ado, thank you for joining us, Dr. Andrews.
Thank you so much for having me. It's really a pleasure to be here with you all this morning. And I'm looking forward to a non-traditional grand rounds where I just talk to you about my journey from a pediatrician and a pediatric researcher into a child health advocate. So thank you so much again for having me here. I don't have anything to disclose this morning. And the official objectives are for you all to be able to assess the importance of engaging in advocacy and the political process at all levels. I'm going to outline some steps to becoming an effective child health advocate. And I hope that you'll appreciate and be able to analyze the breadth and depth of issues that require child health advocacy. And Dr. Schreier just gave us a nice rundown of some of the issues we've seen just in the past couple of years that really do require effective child health advocacy. The other two unofficial objectives are for me to demystify this process and for you to understand that there really isn't anything special about me. I really am just like you. I'm a pediatrician who started my career in a very traditional way, but over time shifted focus into child health advocacy. And if I can do it, then you can do it. And the other thing I want you to take away from this is you don't have to turn the dial up to 100 after this presentation. You don't have to leave today and just give everything you have to child health advocacy. What I hope that each and every one of you do is turn that dial up just a little bit. Find a little small way to engage a little bit further in child health advocacy after you hear what I have to say this morning. So I think it helps just to start with the story and to explain to you a little bit more about who I am aside from my sort of academic credentials. So ever since I was a very small child, I knew I was going to be a doctor. When I was 4.5 years old, I told my preschool teacher that when I grow up, I'm going to be a doctor and a mommy with 3 kids. I have no idea where I got the idea to be a doctor. I didn't have any doctors in my family, but nevertheless, I made this plan, and that's exactly what I am today. I am a pediatrician, a practicing pediatric hospitalist, and I am a mom to 3 incredible kids, my children, Gracie, Henry, and Evelyn. So it really is those 2 vantage points I have in my life that drove me to become a very active child health advocate. So I'm a mom and I'm a pediatrician. A lot of times when I'm speaking to audiences that aren't pediatricians, I have to really outline what I'm talking about when I mean being a pediatrician drove me to be a child health advocate. But as a pediatric hospitalist, I'm sure this will sound familiar to many of you. But what I'm talking about is the 10 years I've spent in the Children's Hospital. Day after day, I have had an up close and personal view of all of the ways in which our society is really failing the most vulnerable among us. And I'm talking about the children we care for and their families. And I really do love my career, but seeing that day after day really made me stop and think how I can use my power and platform as a pediatrician more effectively to fight for policies and changes in the culture of our institutions and our communities that will help these children. So I'm talking about children in our hospital rooms who are hungry and don't have enough food at home. I'm talking about children who fell further behind their peers during the COVID lockdown because they didn't have access to broadband in their homes. I'm talking about kids who are in their hospital rooms alone without their parents because their parents are juggling multiple jobs just to make ends meet. I, like many of you, I'm sure, have talked to parents who are worried about how they're going to pay their hospital bills or wondering if they can afford the prescriptions I'm prescribing for them at discharge. I, like many of you, I'm sure, have cared for a countless number of children who are in the throes of a mental health crisis and can't access mental health care resources in my community. And I've cared for far too many children who have been shot. So working in a children's hospital really laid bare all of the things that I think we should be fighting for a brighter future for all my children, for all of our children. But it really is my role as a mom and my children that really lit that fire inside of me that made me want to spend so much of my time and energy on child health advocacy. So I really am, I'm just a mom who wants to fight for a brighter future for all our kids. I believe that our children deserve leaders that they can look up to. I believe that as pediatricians, we have a duty to understand and advocate for urgent action on climate change so that we have a healthy planet to pass down to our kids. And I understand the urgency of action so that we have a healthy democracy that we can pass down to our kids. I believe that we need an economy that works for everyone and doesn't leave those vulnerable children and their families behind. We need a healthcare system that prioritizes patients, not just drug companies and insurance companies. And I aspire to a world where a child's education quality doesn't depend on their zip code, where the definition of justice doesn't depend on the color of the child's skin, and where gun violence is not the leading cause of death for kids in this country as it is today. And so those are the reasons that I do what I do. And the honest truth is the number one driving reason that I have taken this shift in my career and focused so much on advocacy is because when my children are all grown up and they ask me what I did and what I see as a very pivotal moment in our country's history and our planet's history, I really want my children to be proud of what I tell them I did in this moment. So that's why I focus so much on advocacy in my career. But to dive a little bit deeper, and so you can understand how, this could be any of you. So if we go back to 2008, I was a resident at Cincinnati Children's with Indy. I remember going to co-resident's house to watch the presidential election. I had voted that year, but that is essentially the extent of my involvement in any level of advocacy and anything in the political process. And so that's where I was in 2008. And then since then, I got married and I started my family. So this is Gracie, Henry, and Evelyn. So after residency, I moved to South Carolina, and I really spent those first few years of my career as a pediatric hospitalist focused on building my family. And I think it's important for me to say that because all of you are in very different stages of your lives. And there's sometimes when you have some extra bandwidth to really lean into something like child health advocacy. And there's sometimes when you don't, and that's okay. It might be time in your life to focus on fellowship applications. It might be time in your life to focus on writing your first grant. It might be time in your life to focus on a sick family member. And that's okay. But I want you to understand that even if it's not the right moment for you right now, just be aware and be watching out for when that moment does arrive. If I go back in time to when I was starting my family, there's no way I would have had the energy or the passion or the wherewithal to do what I'm doing today, and that's okay. So a little bit more about what propelled me to work in the arena of gun violence prevention specifically. So it really all anchors on the week of the Parkland shooting at Marjorie Stoneman Douglas High School. So the week of that shooting, my oldest child, Gracie, was in kindergarten. And a couple days after the shooting, I was dropping her off in the kindergarten drop-off line. And for the first time, I really noticed the armed police officer who was patrolling the drop-off line. And actually that person, that was the school resource officer, he had been there all year. But that morning I looked at him differently. And I immediately felt incredibly vulnerable that, I was sending my child into this building. And for the first time, I wasn't really sure that she was safe in that building. And then, she gets out of the car, she's got her little bright pink unicorn backpack on and marches into the school. And she has no idea what I'm thinking about. And as she went into the classroom and I drove back home, I started thinking, okay, I feel worried this morning. I need to do something. So at that point in my life, I was in the habit of calling my elected senators, representatives, and state lawmakers when there was an issue going on at the state or federal level that I was interested in. And so that's what I did. I went home and I called my senators and I left one voicemail. And in the other senator's office, I talked to a staffer and I explained how I was feeling as a mom in light of the Parkland shooting. And I was wondering what the plan was going to be to address school gun violence in our country. And the staffer didn't have a lot to offer me. And I felt really frustrated and a little bit angry in that conversation, that I felt like he had the power to do something and I was his constituent and I wanted him to engage on the issue. So I had a pretty emotional reaction to that conversation, which didn't really feel like me. So I hung up the phone at the end of the conversation and sort of reflected on how I was feeling. And I realized that that feeling I was having meant that it was time for me to turn the dial up a little bit, that just calling their offices like I was in the habit of doing maybe wasn't going to be quite enough. And so that's when I decided to look for my local Moms Demand Action chapter, because I thought maybe that was a way that I could channel these feelings I was having about my own children and their safety in school. And so that's what I did. I found our local chapter and I reached out to the leader and I signed up to go to the next meeting. And I remember that day driving from work to that meeting, and I had very serious thoughts about just forgoing the meeting and going to my home, be with my kids, eat dinner with the family. And I hesitated, but I decided ultimately to go to the meeting. And I'm so glad that I did, because that really accelerated all of the work that I've done over the past few years. So I was sitting in that meeting hearing about sort of their take on the issue of gun violence. And then the leader of the chapter talked about Be Smart, which is their gun safety program, which is meant to educate adults about the importance of secure firearm storage as a way to reduce the incidence of pediatric firearm injuries and deaths. And she said, this is a great program. It's educational, it's evidence informed, it's AAP aligned, and we've been trying to get into the local children's hospital, but we haven't had much luck. And that was a real light bulb moment for me. So I raised my hand and I said, well, that's where I work. I think I can help you. And I really needed that sort of tangible way I could help this group of women so that I could feel like I was part of the group and I had something to offer them. And so in that moment, it grew from something I was doing just to kind of make myself feel better about my own children in school into something I could really do to help this organization. And it started to make me realize that as a pediatrician, regardless of if I worked at the Children's Hospital or not, as a pediatrician, I had a voice and a platform, and I had access to spaces that this organization didn't have access to, and that they could perhaps really use my voice. So I really threw myself into the Be Smart program. And at the time, I was incredibly fortunate to have some amazing residents who were very interested in child health advocacy and interested in gun violence prevention. And they really helped get the momentum going. And so we brought the Be Smart program into our resident primary care clinic. It's now part of our pediatric emergency medicine group, and we do it on the hospital floors as well. But these next sort of 12 months after that first meeting really looked like me showing up a lot. And that's a really important lesson in advocacy, is you have to show up, because if you don't show up, nothing's going to happen. So I showed up to community events on weekends and after hours. I showed up to school events, and we did a lot of educational efforts within our institution, and we made a lot of great progress. as any good academician would, I started to ask myself, okay, how can I turn this into academic productivity? Because I'm spending a lot of time and energy on this gun safety issue. And I felt like there was a way to marry that with my professional duties. You know, part of my professional duty was to mentor residents and to publish papers. And I already had research training from my fellowship. So we decided to do a quality improvement project in our primary care clinic led by this fantastic team of residents. And over a pretty short period of time, we were able to significantly increase the frequency with which we were talking to families about the importance of secure firearm storage. And we got that published in Academic Peds, and we were so proud of it that we made mugs out of our run charts. And that was really an important moment in my journey to realize that there is a very effective way to marry child health advocacy with my role as an academic pediatrician. And then that continued to snowball. So, you know, as my passion grew, as my knowledge on the subject grew, I started looking for other ways to incorporate it into my professional career. And just sort of by happenstance, an old colleague of mine who had moved to Mayo Clinic reached out to me on Twitter because he had seen what I was doing. And he asked if I would come give grand rounds about gun safety. And at the moment, it felt like an incredible opportunity for me to do that. And so I did. And since that time, I have had the great pleasure and privilege of presenting on child health advocacy and pediatric firearm injury and the importance of secure firearm storage at medical schools and children's hospitals all across this country. And what that teaches me is there is space for us to do this, no matter what the topic is you're interested in advocating for, no matter if you have a specific topic in mind. There is so much space for us to do this as academic pediatricians or community pediatricians. And there is a need out there. And I have learned at my own institution that medical students and residents are incredibly interested in these advocacy related topics. So there is a need and a hunger and space out there for us to incorporate this into our professional lives. So I can't talk about my journey as a child health advocate without talking more about Moms Demand Action. And that is because they were the ones who taught me about the problem of firearm injury. You know, I went with a very narrow perspective on the problem, which was my own children's safety in school. And thanks to this organization and my own, you know, research skills, I very quickly understood that the problem was much bigger than school gun violence. In fact, school gun violence makes up a tiny fraction of the number of pediatric firearm injuries and deaths in this country. And I learned about the issue, and I also learned how to be an effective advocate, organizer, and activist from this organization. So I will always be grateful that when I had my moment of wanting to engage more in my community, wanting to help my community in some way, that this organization existed, because here I was not really understanding the problem or knowing what I could do about it. And fortunately for me, there was already a group of organized women in my community who were focused on this exact topic. And that's an important lesson for all of us, because the thing we can't do as academic pediatricians is develop an interest in a topic and then go out to the community and tell them what they need to do to fix the problem. What we need to do is we need to develop an interest in a problem, go out to the community and listen to the people who have been doing the work in the community for decades, who understand the problem at a level that we never will, and let them tell us how we can help them. So I guarantee whatever problem it is you're thinking about addressing, there are members of your community who are already out there doing that work, the work that can be backbreaking and unglamorous. And you need to find them and partner with them and learn from them and let them help you while you help them. So I like to share this screenshot because I think it really encapsulates sort of how fast this journey happened for me and how it could happen for you. So I talked about 2008. In 2016, I was pregnant with my youngest child, and I was a voter. And that, again, that's sort of where it ended. And then fast forward to 2020, and I was very proud to be a voter, and I also was a phone banker for candidates and causes that I believed in, a text banker. I started donating to campaigns and candidates I believed in. I also was a poll worker. I was a leader in my mom's Demand Action chapter. I developed an advocacy curriculum at my own institution, and I became a pretty well-known local gun safety advocate. So again, it's important to understand that this could happen to you at any time, and it is really easy to use all these skills that we've developed as successful professional pediatricians and turn them into a successful advocacy career. The other benefit of connecting with these community organizations is these partnerships that you can develop with these amazing people who are so dedicated to these causes out in the community. And I've developed some really important friendships because of this work in my community. It also allowed me to start to spend time with my own elected officials because I was engaged on this issue and they were engaged on this issue. And so this is a picture from a press conference where two of our our U.S. representatives it was a press conference on a bill to close the Charleston loophole in the church where the Mother Emanuel shooting happened. And so it again opened a lot of opportunities for me to get to know the people who were on the ground doing the work. Now, I couldn't do, and I don't think you can be a successful child health advocate without a great support network. So I couldn't do this work without my husband and my 3 kids and my parents. And so I think it's important to point out that although I say that my children are the reason I do this, they're also the reason I can do this because they're incredibly supportive and flexible and motivating every single day. So now I'm going to kind of get into a little bit of the nitty-gritty of what you can do. So different opportunities to engage in child health advocacy. So the first is calling. So this is a screenshot that I've put in my slide decks for a couple years now because this just highlights how easy it is to do this. So if you haven't already, look up who your elected officials are, your U.S. senators, your U.S. representative, and your state lawmakers. Find their phone numbers to their offices and save them in your phone. That way, when you have something to say about a bill, you can just hit a couple buttons and make a phone call. I am not someone who enjoys talking on the phone, so this seemed intimidating to me at first, but I found a little secret that I like to share, which is you can call before their offices are open and leave voicemails. Because you're not really calling to have a dialogue, you're calling to make your opinion heard, and the people, the staff in the office are really just tallying the phone calls they're getting. So I would drive to work, sit in the parking garage, and before I walked into my office, I would make these phone calls. And you can see from this that it literally took 2 minutes to leave 2 voicemails, and then my advocacy is done for the day. So to me, this is the easiest thing you can start doing tomorrow. So writing can be a really effective way for us to be advocates because we all have writing skills. Some of us may enjoy writing more than others, but as academic pediatricians, we have a lot of experience in writing. So the 2 main ways to write to advance your advocacy are letters to the editor and op-eds. I fully recognize some of you in the audience probably have a lot of experience with this. I know y'all have an incredibly robust state chapter of the AAP. But I'm just going to walk through this a little bit. So letters to the editor are really the lowest hanging fruit as far as writing and advocacy goes. They're faster to write, they're easier to write, and they're much more likely to get published. And this is something, you can see something happen in your city or your town today, write a letter tonight, and could very easily show up in the paper tomorrow. So this was a letter to the editor that I wrote when this is earlier in the pandemic, but something was happening in my town around mask mandates. And it was right at a time our children were still in virtual school, and I was incredibly frustrated at sort of where the town's dialogue had been. So I quickly sat down and wrote this. This is the entirety of the letter. This is something I sat down and wrote in less than 15 minutes. And, when did we stop listening to healthcare experts? Mask mandates work. Our leaders need to listen to experts so that we can return to normal. And then I included sort of a personal anecdote, which was I was getting this news the same day my kids were meeting their teachers to pick up their virtual learning supplies. And so here I am as a mom struggling to figure out how to manage virtual learning while our town is acting like the pandemic is over. Our children need to be in school and they're relying on us to do what is right. I want to live in a society that values its children, and that's why I'll always be a vocal advocate for children in our community. This one's easy, wear your mask so our kids can go back to school. And then it was in the paper the next day. So this didn't take a lot of time. It doesn't take a lot of data and fact finding. And, as you can see, it's a very simple writing structure. So I encourage you to consider doing that. Sort of the next level up would be an op-ed, and this certainly takes more time, more planning, more research. But a piece of advice I got early on was you can sort of pre-write op-eds. If it's an issue is going to come up at the state house level in the next session, go ahead and write one. Or when you experience a patient story that really highlights the need for, expanded Medicaid or whatever it is, go ahead and draft an op-ed so that when the next time that's sort of a topical topic, you can have it ready to go. Op-eds are harder to get published, but as pediatricians, I guarantee you won't have a hard time getting your op-ed published. And so this is an op-ed I wrote after the NRA said that physicians should stay in their lane in regards to gun violence prevention. And actually, I had help from Everytown to write this op-ed. They knew I was already engaged on this issue. They knew I was a healthcare professional in the community, and we worked together to draft and edit this op-ed. So it really did take some of the work off. And your state chapter of the AAP will likely help you do the same thing. And the interesting thing about this one was then it was after the op-ed was published, the paper wrote a story about other doctors in the community, and they interviewed me for that story. So I sort of got 2 bangs for my buck there. This is an incredible resource if you're interested in writing an op-ed. It will tell you about all of the papers who accept op-eds, what their parameters are, who to contact, and it can be a really great resource to get you started. So another level of advocacy is media interviews, TV interviews. And this is something I was incredibly uncomfortable with when I first started. But fortunately, one of my great advocacy mentors here in South Carolina is Dr. Elizabeth Mack, and she's very involved in the AAP. And she encouraged me to get over myself and to start doing these media interviews. And these can come really in 2 different forms. It can come through an official request from the media to your institution, and then they reach out to, the group of pediatricians who are interested in doing media interviews. Hey, we need somebody today to talk about flu vaccines, or we need somebody today to talk about safety and trick-or-treating. And if that's something you're interested in doing, then find your media people at your institution and let them know that you're interested in being on that list of folks who can do these interviews. The other way these interviews can come about is outside of your institution. If people know that you are a practicing pediatrician and they may just want to talk to you in your role as a pediatrician, not tied to your institution. And I think it's really important for you to understand and for you to work with your media relations folks to understand when you can represent your institution and when you're speaking as a community pediatrician. But it's important for you to always know that as a citizen, you have the right to do interviews. It's just a matter of when you can associate yourself with your institution or not. So this picture here is an interview where I was officially, I'm in my office here at MUSC, and I'm doing an interview about the mental health crisis related to COVID. And this interview on the left, I'm a local pediatrician and a member of Moms Demand Action, and I'm talking about something related to gun violence prevention. So you can do them both ways, and I encourage you to sort of just get over it and try it, and they will become more comfortable the more of them that you do. And it can be a really effective way to get your message into the homes of a lot of folks in your community. So the next step you can take is to meet with your legislators. And one of the silver linings of COVID is all of our lawmakers are far more comfortable with virtual meetings than they ever were before. And that can be incredibly helpful if you don't live in your state's capital and it's difficult to get to the capital to have these meetings. So I encourage you to find opportunities to have meetings with your state lawmakers. So this image here is 3 pediatricians and then Kristen, who's a teacher and a gun safety advocate in the community. And we're meeting with Senator Marlon Kimpson. And this was a meeting before a subcommittee meeting was going to take place in Columbia on an open carry bill. And we were very opposed to the open carry bill passing. And we knew that Senator Kimpson was also opposed to the open carry bill. So the purpose of this meeting wasn't to persuade him or convince him how to vote. It was to strategize and for us to understand sort of what was happening in the state Senate at the time, who were the key players, who were the people that we might need to persuade to vote against this bill. And at the same time, we were there to offer our expertise as healthcare providers and gun safety advocates about the statistics and what open carry might look like in our state. And so we helped him and he helped us. And that can be a very effective kind of meeting to have with your lawmakers. Now, on the flip side, this was a meeting, and I cut out the lawmakers picture here, but I think this picture is kind of funny because you can tell most of us are not very happy during this meeting, but this was sort of the converse meeting. And this was someone who we knew by his voting record would likely support open carry. And the purpose of this meeting, we didn't necessarily think we were going to persuade him to vote differently, but we wanted him to hear our perspectives as members of the community. So we have a grandmother, me, a pediatrician, Kristen, a teacher, Jean, someone who works with survivors of domestic violence, Kristen down there works in the food and beverage industry, and then Jeremy in the middle is a faith leader in our community. So we went around the circle and told this lawmaker why we don't support open carry. And of course, I talked about the children I've cared for who had been shot. And really, we wanted him to hear us out, but then we also wanted to sort of gauge his reaction and see which of these talking points might be the most effective to lean into. And interestingly, during this meeting, it was the testimony or the conversation with the food and beverage industry person that really sort of seemed to strike a nerve with him. So then we ended up leaning into that avenue of discussion. So that was all to prepare for a subcommittee meeting. And then there's testifying. So some of you have probably testified at the state level, and that's another thing that seemed really intimidating to me until I started doing it. And so I think it's important to understand that testifying, you write your testimony ahead of time, and then you literally read it, whether you're virtually there or there in person. And what I was so worried about was I would read my testimony and then I would engage in like a long debate with the lawmakers. And that almost never happens. It can happen, but it almost never happens. Almost always you introduce yourself, you read your testimony, you sit down, and they move to the next person. Now your testimony is then in the record of the subcommittee meeting, and that is incredibly valuable. It is possible for them to do a back and forth with questions, and that has happened to me, but I will tell you that we underestimate what our expertise level is, and most of the people in these rooms don't have anywhere near the expertise on these issues that we have, so you should feel relatively comfortable engaging in a back and forth with the lawmaker. So don't let that stop you from testifying. So we organized and testified against the open carry bill here in South Carolina. And the end of the story is that the bill did pass, and we anticipated that it would pass based on the makeup of our state legislature currently. But it was still important for us to be there. Even though we knew it was going to pass, it was important for us to be there and to voice our opinion as concerned doctors. And so this is me and Dr. Mack and one of my fellows, Dr. Otto. And I was really proud that the next morning after this subcommittee meeting, this was the headline in our local paper. And again, we didn't win the vote, but we got this headline out there so that now folks who are reading this paper can see that law enforcement and doctors are aligned in opposition to this bill. And so that should make people wonder, okay, what are my lawmakers up to if it's something doctors think is bad and something law enforcement thinks is bad? So there is value, even when overall this was a loss for us, there is value in the work that we did. And this will ultimately come back to help us as these conversations in South Carolina progress. I always like to share this text message that I got from my fellow that day. She came to fellowship with the goal of testifying at some point during her fellowship. That morning, it was her first time. We met beforehand. She was very nervous. We both went to our offices and logged onto the virtual meeting, and this is what she sent me a few minutes later. And I think it's important to understand that a lot of the folks that show up to testify, regardless of what the topic is, they're average citizens who don't have any expertise. They have an opinion, and that's an incredibly valid reason to testify. But don't underestimate the expertise you have and how you can really drive the conversation back to evidence and facts, because that is what we bring to the table. The other benefit of testifying is that happens in a small subcommittee meeting, but then the whole body debates the bill, right? So this is the floor of the South Carolina Senate, and this is Senator Marlin Kimpson, who we had coordinated with over this process. And the other lawmakers tried to misrepresent the testimony that had been present during the subcommittee meeting, and they really just talked about the folks who testified in support of the bill, but they neglected to mention all of our testimony in opposition to the bill. So he was able to get up there on the floor of the Senate, and he didn't read all of our testimony, but he explained what our testimony said. He said, my colleagues haven't mentioned the doctors that came to testify, and I heard from a trauma surgeon and a critical care doctor and a pediatrician about, X, Y, and Z. And so that was a powerful way to get our message all the way to the floor of the Senate. So that's another benefit to testifying. A fun part of this child health advocacy is the networking you can do. And I think it's important to understand, we just saw Representative Schreier this morning, that our representatives are real people. They're members of our community. They're eager to talk to us and learn from our expertise. And you can have fun while you do this and develop relationships with lawmakers and local leaders on advocacy issues of all types. So volunteering is a critical component to advocacy. And I think if you want to have real street credit in your community when you speak up on issues, you have to be willing to show up and volunteer your time. So just because we're professionals doesn't mean we're above doing that really unglamorous work that can take up so much time. So I make it a point to continue to volunteer in some way in my community. And of course, that's going to look like a million different things for a million different people. So I do, a lot of phone banking when there's an opportunity, when the local communities invite speakers for forums on gun violence. As long as I can be there, I am there. And these are hours-long meetings, but you take the time to be there, and it's important to show up, and that helps you develop your reputation in the community as someone who is truly invested and not just swooping in when the TV cameras are on. Another great way to engage in child health advocacy is promoting voter registration. So we've done a lot of work at MUSC with voter registration efforts the past few election cycles. Last year, we partnered with this SNMA chapter, and at lunchtime, we set up these great voter registration tables, and we spent a lot of time educating employees about the date of the election, their polling place, the rules around early voting, and it was a really positive experience and a way for us to interact with students and residents at a sort of a different level. And this image on the right is a collage of our residents. So for the past few election cycles, we've sort of made a competition out of voting, and we encourage our residents to vote and send us selfies from the voting booth or send us selfies with their absentee mail-in ballots. And then we do a drawing. And, I was just really proud of the residency for posting this collage last cycle. And then I want to include this because I think it's, again, we all underestimate the platforms that we have in our communities and even nationally, and we all underestimate our expertise. So when I joined Moms Demand Action a few years ago, I never imagined that in just a few short years, I would have the opportunity to sit down and talk to Shannon Watts, who's the founder of that organization. And so this was actually for a session at PAS that was focused on the legislative approach to solving the gun violence epidemic. And so we recorded an interview, and it was just a really fantastic discussion. And then it turned into this opportunity to co-write and co-author this health affairs blog piece on pediatric gun violence. So again, we have these platforms. We just have to sort of find a way to get out there, make these connections, and make our voices heard. And so I'm just going to shift gears for the last few minutes and talk to you about some sort of high-level lessons learned and things I want you to take away from this. First is you don't have to be a born advocate to be an effective advocate. At the beginning of my career, I identified as a clinical researcher. I never in a million years thought this is where I would be today. So no matter if you're a med ed person or a researcher or strictly clinical person, there is a way to build advocacy into what you're doing. And it doesn't have to be dialed up to 100. It can be just a little bit every once in a while. And it's also possible to totally shift gears, which is essentially what I have done in my career. So just because you started out as a med ed person or a researcher doesn't mean you can't shift your focus to become a child health advocacy focused person. You have to understand how desperately people need your voice, our voices as pediatricians. I think Dr. Schreier illustrated this very well, but again, I wasn't aware of what kind of power my voice could have in my community just simply by nature of my background as a pediatrician and my willingness to speak up. So kids need us to speak up for them, to speak up for things like combating vaccine disinformation, evidence-based approaches to reducing gun violence prevention. The kids need us to speak up for them, and we carry that expertise, and people will listen if we start speaking up. And that's the other thing that really sort of accelerated my path is people were listening to me. I'd be on panels with members of the community who'd been doing gun violence prevention work for a long time. And I would essentially say the same thing they were saying, but because of the letters behind my name, people took me more seriously. Now, I don't think that's the way the world should work, but it's the way the world works. And so we can lend our voices to these causes and really help folks accelerate change. So do something. This goes back to not needing to dial it up to 100. So this can seem incredibly overwhelming. Certainly the problem of gun violence among children is incredibly overwhelming if you think about it in that sense. But think about these small things that you can do every day, these small steps you can take to get more engaged in your community. And those small steps will eventually build into bigger steps and will create change. The only thing more powerful than using your own individual voice is inspiring others to use theirs. So I know that I am always looking around to find inspiration from other people. And I will tell you, in the field of pediatrics, we have no shortage of inspiring leaders. So look to those people for inspiration. And then know that when you start engaging, before you even know it, you're going to be inspiring people around you as well. And that is incredibly powerful. You have to remember that it's a marathon, not a sprint. You're not going to solve the problem overnight, but your goal is to make progress. You also need to understand that you're not going to win every time. So like that open carry bill, that was a loss, but we learned a lot from it. We gained a lot of experience. We grew our relationships with our lawmakers, and that will eventually help serve us when the next fight comes up. So be persistent to the point of wondering if you are obnoxious. So if you want to develop expertise in something, or you want to start to be seen as a national leader on an issue, you have to be persistent. You have to talk about the issue all the time. You know, when I walk around my office building here, when people see me, I want them to think, oh, there's Annie. She's all about gun violence prevention. Or when a meeting is happening in another part of campus and it's about guns, I want them to think, is Dr. Andrews invited to this meeting? I want people to associate me with this issue, and that takes being incredibly persistent. As I gained awareness about the breadth and depth of the problem of pediatric firearm injuries, it would have been really easy to just feel defeated and to feel a sense of despair or hopelessness. But what I have found is the key to combating those feelings is to act, and action will really bring hope like within and also bring hope to people who are watching the actions you're taking. And then remember that advocacy itself it's the action that you're doing, but the goal is not just to be an advocate. The goal is a brighter future for all of our children. The goal is health equity. The goal is to create change that benefits children in our society. And advocacy is just the action that we take to achieve that goal. And then I'm just going to end with these two images because this just happened last week. And I think it's a good example of how establishing your expertise, developing relationships with national leaders, which is much easier than you think because of our background as pediatricians. So we had a tragic event happen in my community in North Charleston where children were on the Little League field and dozens of shots rang out in the parking lot. And some of you may have seen the video of children ducking from bullets while they're trying to play their Little League game. And that video really broke through. You know, it's hard to predict which of these tragedies are going to break through, but that one did. And because I had already established myself as an expert on this issue, I was very quickly able to come up with a plan to turn the fact that the nation was again looking at my community and its epidemic of gun violence, to turn that into an opportunity to educate people and to inspire people to get involved. So I had this Zoom conversation with Fred Guttenberg, whose child was killed in the Parkland shooting, and Dr. Joe Saccharin, who's a trauma surgeon at Hopkins and also a gun violence survivor, who are national leaders on this issue. And they were so gracious to join me for this conversation. And it really was an incredibly inspiring conversation. And that week also, I was able to do an Instagram live with Shannon Watts to talk about, again, the state of gun violence in South Carolina, what I was doing about it and what I thought people needed to do about it. So as you sort of grow your reputation, there will be these opportunities to engage. And I always like to end my talks with this quote. And I will just leave that on the screen and then I will open it up for questions.
Wow. Amazing. Thank you, Dr. Andrews. I don't know where to start. we have any questions from the chat, or Dr. Kemper in the auditorium might help us if there's any questions from there.
Indy, I put a message in the chat for you if you want to read that to everyone who may not be able to access the chat. Can you see that? And then for others who are interested in having a comment or a question, please feel free to use the chat feature.
Suzanne, maybe you should just say it. Go ahead and I'm not sure which message you're talking about. Sorry.
Okay, I got it. Hold on a second. There is a pediatrician. Her name is Leila Rabe, and she is local, doing similar work to what Dr. Andrews is doing. So you can look her up online to see what kind of work she's doing. And if you're interested, you can read more about her. And I'll put her website in the chat also. And then I can see from Dr. Susan Marshall, Annie, wow, so amazing. Thank you so much for sharing your story with us. So inspiring.
Thank you. Yeah. Oh, go ahead, Indy.
Sorry, there's a question from the residents in the auditorium. One of the questions, I guess they can't get their microphone to work. One of the questions was, what is the actual breakdown of your time right now? How do you balance research, advocacy, clinical work, your family?
Yeah, so my time is a little different now, but back the first half of this academic year, I had about 20% funding from my department to direct the advocacy curriculum, which was incredibly generous of my chair and not super common. But so I had that funding for advocacy. I had about 15 to 20% funding for research and funding as the pediatric hospital medicine director, and then the balance of that was clinical work in the hospital. So you know, as people probably are aware, that funding levels change year to year, but I was able to get to a spot where it was a really great balance of the different parts of my career that I really enjoyed. And I think to the comment about the work going on in Seattle, I mean, Seattle really has been a leader in promoting secure storage of firearms, gun buybacks, you know, gun safe promotions and giveaways. So there's a lot of incredible work going on in Seattle.
Got a question from Mike Aronson, one of our third-year residents. What has the transition been like going from an evidence-based reading and writing job to motivational speaking, policy-focused profession?
That's a really good question. And I had an experience a few weeks ago where I gave one very academic, data-driven talk, and then a couple days later, a much, you know, more motivational talk. And it is a little bit jarring to figure out how to do both of those things well. And one of the questions I sort of asked myself is, why are our traditional academic talks so dry and devoid of emotion and motivation? And then why are some, you know, health policy-based talks so devoid of data? Like, I really think the two are, you know, the two could learn so much from each other. And maybe that's something I can, you know, continue to grow and like find a way to meet in the middle. But the one benefit is when I'm able to give a very like academic talk, I feel so comfortable in that space compared to some of the spaces I've been speaking in lately. So it is nice to just have that sense of comfort because I've been doing that kind of talk for such a long time. So, you know, I think there's so many different ways to engage in advocacy, and I considered exploring running for public office in much the same way Dr. Schreier did, in that as you start to spend time in these spaces, you sort of realize that there is a deficiency of healthcare professionals in a lot of these spaces, and not just in, you know, the lawmaking spaces, but in so many of these organizations. You know, they really are hungry for folks like us with a scientific background. And so I encourage people to find whatever path feels natural to them, because there's lots of different endpoints and ways to engage in policy making. And the biggest lesson I've learned is we need more folks with a scientific background publicly sharing what evidence-based medicine is, what evidence-based solutions to some of these problems are, because there's so much evidence in our journals that doesn't get translated into policy because we're missing that link, and that link is us.
Another question from Annie Anderson about setting up a palliative care coalition across multiple states. You know, we have patients and serve multiple states up here. Any advice on how to deal with 5 different legislatures?
That is a question I don't really have an answer to, but that is not an enviable position to be in. It's hard enough to, work with just one state legislature. So I'd imagine that is an incredible challenge. I'm sure that Seattle Children's has some really fantastic government relations folks who have far more experience than I in getting lawmakers to the table to agree and to work together. But that certainly is a challenge. And I think that's a challenge that the healthcare industry as a whole faces, that rules are so different state to state, and that can create barriers not just to advocacy but barriers to care. And something that I honestly think if there were more physicians in office, we wouldn't have these really stringent state line problems, because we see every day I see how hard it is to get a patient transferred to North Carolina or whatever. And, it's because people don't understand these sort of real world results of their policies that we have these challenges of working state to state.
It's especially interesting because, you can imagine Oregon and Washington are very liberal states. We're surrounded by some fairly conservative areas. And so priorities may be different across the different states, whereas hopefully medicine and evidence and things like that are uniform and universal.
Mm-hmm.
So another question from a resident in the auditorium, whether you found it difficult to navigate institutional barriers to do this sort of work outside the box.
Yeah, so I said this recently that, certainly when I decided to pursue the gun safety education in clinic, I never walked into a room and got a standing ovation from leaders, but at the same time, I had been at this institution long enough that I had developed some political capital. Folks knew I was a hard worker and that I was trustworthy. And so we started really small. And if I had gone to, the CMO of Children's Hospital and said, I think we need to be talking to our families about guns, I think I would have been shut down. But what we did was we started small at one clinic, at our resident clinic. And again, I didn't ask the CMO for permission. I asked the clinic medical director for permission. And one of the things I think we sometimes forget when we get into these conversations with what other people might perceive as very political topics is these are AAP. The AAP tells us we should be talking to families about guns. And so you can always fall back on the AAP. And, the AAP has been so incredibly vocal and, supportive of everything that we've been going through with the pandemic and the attacks on transgender youth, et cetera, that remember that they are an incredible resource. So if someone had said, no, you can't talk about guns in our clinic, I could have just shown them the AAP policy statement that said pediatricians should talk to families about guns. So, we were strategic in that we started small. We asked permission from the direct leader rather than the big leader. And then we just developed momentum and we had success. And we also got covered in the local paper with the work we were doing in that one clinic. And then, in my opinion, the institution really had no choice but to say, oh, wow, this is great. Yeah, we support this. This is cool. Let's keep doing this.